What are the VA priority groups and how do they affect me? 1 through 8, we already covered that. What factors will VA use to assign me to a priority group? So they're going to base it on a couple of things: your military service history, and your disability rating, and your income level, and whether or not you qualify for Medicaid, and other benefits you may be receiving, like VA pension benefits. Priority Group 1. The verbiage here is everything with the VA. We may assign you to Priority Group 1 if any of the below descriptions are true. You have a service-connected disability that we've rated as 50% or more disabling, or you have a service-connected disability that we've concluded makes you unable to work, also called unemployable, or receive the Medal of Honor. So 50% or higher, I fall in that category, or unemployable, that would be the TDIU category, or if you've received the Medal of Honor. So that's the highest group. Priority Group 2 is assigned to veterans that have service-connected disabilities that we've rated as 30 or 40% disabling. Priority Group 1, once you get to 50%, everything is covered. Priority Group 3. You may be assigned to Priority Group 3 if any of the following descriptions are true. You're a former POW, received a Purple Heart, were discharged for a disability that was caused by or got worse because of your active duty service, or have a service-connected disability that we've rated as 10 or 20% disabling, or were awarded special eligibility classification under Title 38 USC 1151, benefits for individuals disabled by treatment or vocational rehabilitation. So if you were med boarded out and you had any of these other disabilities, or you're at the 10 or 20% level, you'll get into Priority Group 3. And this might be a good time to point out, if you don't understand exactly why you're in one of these priority groups, I'd reach out to the patient advocate at the VA and have them explain it to you. This is a guideline, but as you can see, there's a lot of bold letters and there's and or statements. So you might need to have them explain why you ended up in the priority group that you're actually in. Priority Group 4. You may be assigned to this group if you're receiving VA aid and attendance or household benefits, or have received a VA determination of being catastrophically disabled. So more different markers: aid and attendance, housebound, those are special monthly compensations, or if you're catastrophically disabled. Priority Group 5. You don't have a service-connected disability, or you have a non-compensable service-connected disability that we've rated at 0% disabling, and you have an annual income level that's below our adjusted income limits based on your zip code, or you're receiving VA pension benefits, or you're eligible for Medicaid programs. So this one is non-compensable, obviously means you're not getting paid, you're at 0%. And then they're also going to take a look at your zip code. So it's a income test on this one. VA pension benefits, Medicaid, and then they're going to look at your zip code. Priority Group 6. You have a compensable service-connected disability that we've rated at 0% disabling. Here's this one again. Or you were exposed to ionizing radiation during atmospheric testing, or during the occupation of Hiroshima or Nagasaki, or participated in Project 1112, or served in the Republic of Vietnam between 62 and 75, served in the Persian Gulf War between August 2nd, 1990 and November 1998, or served on active duty at Camp Lejeune for at least 30 days between August 1st, 53 and December 31st, 1987. Priority Group 6 it's another one that has 0% disabling, non-compensable, but it has a lot of these presumptive conditions in here. Hiroshima, Nagasaki, that there's probably not a whole lot of people in that group. But Vietnam War, Persian Gulf, Camp Lejeune, contaminated water, Those all have presumptions associated with them, depending on what your disability is. Best to get a rating for it. You may also be assigned to priority group 6 if you meet all the requirements listed below. You're currently or newly enrolled in VA healthcare, and you served in a theater of combat operations after November 11th, 98, or were discharged from active duty on or after January 28th, 2003, and were discharged less than 5 years ago. Note, as a returning combat veteran, you're eligible for these enhanced benefits for 5 years after discharge. At the end of this enhanced enrollment period, we'll assign you to the highest priority group you qualify for at the time. So here's another one with and or statements. I guess this one just has and statements. If you fall in this category and you don't understand why you're in the priority group that you're in, ask questions in the comments. You can also hit me up on Discord if you want to, or better yet, call the VA patient advocate and ask them why they placed you in one of these priority groups. Priority group 7. You'll be assigned there if your gross household income is below the geographically adjusted income limits, GMT, for where you live. That's zip code based. And you agree to copays. So this we're going to have copays for doctor's visits and for prescriptions. And then priority group 8 is the lowest. This one, your gross household income is above VA income limits and geographically adjusted income limits for where you live, and you agree to copays